Bismillahirrahmanirrahim. I am Dr. Mudassir, Associate Professor, Sara Medical College, Narwal. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Today we are going to discuss about the posterior compartment of the thigh, which is very important compartment in the sense that most of the injuries which are related with the sports, they occur in the hamstring compartment. We do hear very often that such and such player has got hamstring strain or hamstring injury and is unable to play. So posterior compartment of thigh. First of all, we see this slide that the how here is the thigh and it is black line dividing into cross section. This is to show that how the thigh is divided into different compartments. So here we see in this diagram that the two septas, they are separating the different compartment from each other. So if this is anterior compartment, so intermuscular septa here separating the posterior compartment, and the posterior compartment is separated from the medial compartment by another septa, intermuscular septa, and similarly the uh, medial and anterior compartment. So here lies the posterior compartment. We see here that we will see the details in later on, but here we see that three muscles we can see in this diagram, 1, 2 and 3, and in between, deep to this, between it and the anterior and medial compartment is the lying the neurovascular bundle of the posterior compartment of thigh. So in transection we can understand this. In this transectional view, what we are seeing that the posterior compartment consists of SM, ST and BF muscles. And SM is a semimembranosus, ST is a semitendinosus, and BF means the biceps femoris muscle, same like the biceps brachii muscles in the upper limb. And deep this bicep over the medial compartment, medial side of the lateral side of the medial compartment, lying the great nerve, sciatic nerve, which is the biggest nerve of the limb, lower limb, and also the posterior compartment. So the posterior compartment has four muscles: biceps femoris, semitendinosus, semimembranosus, ischial part of the adductor magnus muscle, hamstring part of the adductor magnus muscle. Action will be extension of hip, flexion of knee. The blood supply will be coming from profunda femoris artery, and the nerve of the posterior compartment is the sciatic nerve. So first of all, we discuss the hamstring group of muscles. There are four muscles: biceps femoris, semitendinosus, semimembranosus, semitendinosus, and hamstring part of adductor magnus muscle. So first, we see that the ischial head of the adductor magnus. So here we see from the ischium originating and the pubic bone. Pubic part will be there and there will be ischial part. Ischium originating the muscle and inserted over the medial side of the tibial tuberosity. So here is the adductor tubercle of the femur, we can see. So its origin from the chest tuberosity and ischial ramus. Insertion is over the adductor tubercle of the femur, and nerve supply will be the sciatic nerve, and is actually the extension and the flexion of the knee. Next is the biceps femoris. Biceps means having two heads. One will be the long head and other will be the short head. Long head is originating from the ischial tuberosity, while the short head is originating from the posterior surface of the femur. Both heads they unite together and they are inserted over um, the head of the fibula. So attachment is from the ischial tuberosity, shorted from the linea aspera on the posterior surface of the femur, and they will be inserted into the head of the fibula. Action is the same. It's also extend the thigh and laterally rotate at hip and knee. It's also produce lateral rotation. Innervation. Long head is innervated by tibial part, while the short head is innervated by the common peroneal part. Because this will not be called as this muscle will not be called as hybrid muscle because the nerve is the same one, the sciatic nerve. They are not two nerves, but the adductor magnus will be named as hybrid because it is having a nerve supply from two different nerves, that is obturator nerve for the adductor part and the sciatic nerve for the hamstring part. Next muscle is the semimembranosus. It has the same origin from the ischial tuberosity, coming down over the medial side and inserted over the medial side of the condyle of tibia. But from here we see that a membranous like oblique popliteal ligament originating coming from the semimembranosus and inserted over the intercondylar fossa of the femur. This is the additional attachment of the semimembranosus, which form the oblique popliteal ligament. Action will be the same, and the nerve supply will be the tibial part of the sciatic nerve. Then we see semitendinosus is tendon-like insertion, while we have seen that in the semimembranosus the insertion was membrane-like, having origin same from ischial tuberosity, inserted over the medial surface of the tibia, condyle of tibia, and action will be the same. That's the extension of the thigh and the flexion of the knee. But additional action here is that it's medially rotated to the thigh at the hip and the leg at the knee. So it causes medial rotation also. So this slide was to compare the two, compare the action of the two from the anterior compartment and the posterior compartment. So quadriceps and hamstring in the leg are another antagonist pair. They are antagonist pair. And the answers for this question is which joint they move, hip and knee joint. Which type of movement are produced? Flexion at the hip by the quadriceps, while extension of the hip joint by the hamstring muscle. Extension of the knee by quadriceps, while the flexion of the knee by hamstring muscles. Which is the flexor and which is the extensor? At the hip, quadriceps are flexor, hamstring extensor. But at the knee, the quadriceps they are extensor and the hamstring they are flexor. Identify origin and insertion of each muscle that we have seen before. So now we have seen the muscles. Now is the sciatic nerve. In the gluteal region we have seen that the nerve is coming out of the pelvis through the greater sciatic foramina under the cover of piriformis muscle, and below the piriform muscle enter into the gluteal region. Then it curves down on the posterior surface, and after that it runs vertically downward up to the junction of upper 2/3 and lower 1/3 of the thigh, and divides into two nerves, tibial and laterally the common peroneal nerve. So its root value L4, L45, S1, S2, S3 remains lumbosacral plexus, the largest nerve in the body, and consists of two nerves, tibial and common peroneal, separates proximally to the popliteal fossa, and so when they leave the pelvis, tibial component passes inferior to piriformis, while the common peroneal passes through the piriformis or superior to it. So here we see that the nerve is coming out of the pelvis through the greater sciatic foramina and is coming below the piriformis into the gluteal region, and during its travel it will be covered by the gluteus maximus as well as part of gluteus medius. Not part of little bit, but mainly it is covered by the gluteus maximus muscle, and it is running over the superior gemini, obturator internus, inferior gemini, then the quadriceps femoris, and then over the adductor part of the uh, over the adductor magnus, and it is then covered by the crossed and covered by the biceps femoris muscles. Here will be the origin of twist. When it comes at the apex of the popliteal fossa, upper end of the popliteal fossa, it divides into two. One is tibial and another one is the common peroneal part. So a branch of sacropraxis, L4, 5, S1, S2, S3, and it emerges from the pelvis through the greater sciatic foramina below the piriformis, runs curves downward and laterally, and lies on ischial spine, superior gemellus, obturator internus, inferior gemellus, quadratus femoris to reach the back of the adductor magnus muscle, and related posteriorly to the posterior pectineus nerve of the thigh and gluteus maximus muscle. Leaves the gluteal region, passing deep to the long head of the biceps femoris and to the back of the thigh, and it terminates dividing into two nerves, tibial and common peroneal. Sciatic nerve injuries are very common, and sciatica pain is very common in our society, and it can be due to the at the level where the nerve is coming out of the by its roots are coming out of the vertebral column by the compression by the intervertebral disc, and it can be due to the dislocation of the hip joint because it is related close to the hip joint. Muscles, hamstring muscles, below knee there will be motor loss, and foot drop there will be sensory loss, will be below the knee except the medial side of the leg and the foot to the ball, foot up to the ball of big toe. And loss of sensation of the sole makes patient vulnerable to trophic ulcers of the foot. So sciatica is a pain, is a disease which is very common in our society. It causes the pain along the sensory distribution, and it is on the posterior aspect of the thigh. The pain runs on the posterior aspect of the thigh, posterior lateral side of the leg, and lateral part of the foot. The pain can be anywhere here. It's not necessary that pain should be here, not here, but it can present with pain only here, or pain in the leg only. Now is the blood supply of the posterior compartment of the thigh. The blood supply does not come directly from the pelvis or from the anterior surface of the thigh, but it is mostly supplied by the perforator branches which are coming into the posterior compartment of the thigh by perforating adductor magnus muscle, and these perforations are from the big branch of the femoral artery, that is the profunda femoral artery, which supplies the medial as well as the posterior compartment of the thigh. But this perforator, the first perforator and further branches of the profunda, they are making two anastomosis. One was the trochanteric anastomosis, other was the cruciate anastomosis. These are made by the, you can see here is the cruciate anastomosis, and above that will be the trochanteric anastomosis in which profunda femoris branches, the lateral and medial circumflex femoral, and the first perforator branch of the profunda femoris, and from above the superior and inferior gluteal artery, which are the arteries of the internal iliac artery. They are anastomosed together. So what we understood is that the blood supply of the posterior compartment is mainly by the second perforating artery, third perforating artery, fourth perforating artery, and will be first perforating artery, which is taking part in the anastomosis. So here again we see that from above, very short segment, inferior gluteal artery, which is mainly taking part in the anastomosis formation. Otherwise, the perforating branches of the profunda femoris, they are supplying the blood to the posterior compartment of the thigh. So hamstring injuries are very common in the sports, and especially in the footballers and in cricketers also, with which there is great running, and then in those the hamstring injury most commonly occur. And also here the physiotherapist is very important in dealing with these injuries. So hamstring strain are very common, and this strain is one or more of your three muscles stretch. They are stretched too far. The muscle might even start to tear. So treatment is RICE means that the compression as well as the application of the ice and other things, local applications, anti-inflammatory painkillers, that is non-steroidal anti-inflammatory drugs, and stretch and strengthens. Prevention is by the exercises, strengthen your hamstrings. So what is a hamstring strain? Strain is a stretch, tear, or a rip of the muscles or adjacent tissue of the biceps femoris, semitendinosus or semimembranosus. Look, the adductor part is not commonly involved. So here are different exercises which are advised to the players, so they should exercise them to strengthen their hamstring muscles, so that during play they should not have the hamstring injury. And these are another diagram showing the exercises performed every other 3 sets of the reps. So we see that this is about the posterior compartment of the thigh. So inshallah next we will discuss other part of the anatomy. Allah Hafiz.